looking back, is there anything that you wish you knew when you were starting out as a doctor? Is there anything that you wish you could go back and say to your young self, like, be aware?
HRT and GLP-1s, kind of need to watch the space.
What's your relationship with pharmacists? Do you find us a bit annoying?
Men are much more decisive. They are much more better sort of quick on their feet, whereas women are much more sort of they consider all angles,
Yeah.
and they're much more careful.
I came across a couple of very trendy, big TikTok trends at the moment, which revolve medicine. One of them is called Speak Your Mind Ice Bucket Challenge Revival, revived by Wade Jefferson. Hello, everyone. Welcome back to Nadia's Lab. As you already know, I'm a clinical pharmacist working in research, and I host this podcast to talk about healthcare, medicine, what is it like to work as a pharmacist, what is it like to work in healthcare, but also lifestyle and I like to have some personal deep conversations. Today, I am joined by the gorgeous, intelligent, lovely Dr. Chanel Kavinska.
Hi.
Dr. Chanel is also my colleague and a friend of mine. Chanel, thank you for coming here today. I'm very grateful to have you.
Thank you for having me. I love it. Thank you.
I know that you're very busy, but thank you for taking your time and joining my little lab. How have you been? What's new?
I've been good. Yeah, I'm very excited because the summer is coming, so everyone feels a lot better once you have a nicer weather.
I know.
And when I come back home from work, it's no longer dark, so that helps as well. Just support, doing your other things. Yeah, it's
I
all
know.
good.
I remember, when you finish work and if it's dark, you just want to go home and sleep.
Yeah.
Whereas now I'm like, okay, I can
I can actually
socialize.
achieve something more.
I can do something, right? I feel the same. So I prepared some topics and questions. And as you know, I have tons of questions for you. But I wanted to go into a bit of personal questions for the beginning. And you are a doctor, and I admire you a lot for doing that. And I wanted to ask you, what made you study medicine in first place? Like, what kind of sparked your passion for medicine? And was there any specific moment or person or anything that made you, you know what, I want to be a doctor. I want to heal people. I want to help people. What was it that kind of made you become a doctor?
So it's going to be very cliche, but it was actually my grandfather. So he was a doctor. He was a lung specialist, respiratory consultant. He was practicing in Poland, and he was brilliant. Like the whole city loved him and known him. He would have patients at home, so he had a sort of a clinic at home, and then we would be always sort of interacting with the patients as well, because I would be seeing them all the time. And actually, I really liked what he was doing. I was always playing in his office when he wasn't there, or looking at the medications that he kept in a little cupboard. So all of those things was really inspirational. He was very smart, and he always said, "Oh, you're the smartest of the family." I was like,
He was right. He was right.
So yeah, I think he inspired me, and then I started playing with all the things that he was giving me. So there was like little, syringes and things like that. So I had my little hospital. Anyway, this is way too long. But yeah, I had
we got all the time.
my little hospital, and all of this kind of, made me
Oh,
think
I love that. That's actually one of the most wholesome stories I've heard. So it wasn't like someone forced you or you wanted to be a doctor. It's just that those were your toys as a
those
child.
are my toys. Yeah, I had a whole Excel
lovely.
spreadsheet for my toys.
Oh, I love that. Okay, my next question was gonna be, you're someone very young and you've already accomplished a lot. Was there anything that was difficult, or looking back, is there anything that you wish you knew when you were starting out as a doctor? Is there anything that you wish you could go back and say to your young self, like, be aware, this is gonna be the case?
Yeah, I think one of the other sort of what I thought at the time was one of the perks of being a doctor is that medicine is the same around the world. We're all humans. We have the same diseases, and therefore this is going to be an international career. This is going to be very easy to travel the world with medicine, right? And now is, I think, one of the biggest disappointments that actually it's very difficult. It's very difficult. The laws are very different. The certifications you need to get are very different. You have to speak the local language whenever you move somewhere. And they create sort of barriers because obviously there's also different medications. The pharmaceutical industry is different in every country, and what they use is different. So that's definitely something that I wish I knew at the time. I think that wouldn't change my decision, but I sort of the expectation would be different.
Yeah, actually agree with you. And that's something you don't know. Because I personally, I'm a pharmacist, and I wouldn't be able to practice easily in another country unless it's like an English speaking country, because I do not recognize the medication's name. It's
Exactly.
really difficult.
Yeah.
And also the universities here, they kind of like teach you very particular laws and you know, how you diagnose patients and like guidelines to the country. So I agree with you. That's a very good point. And if you weren't a doctor, is there anything else? What else would you be if you weren't a doctor?
I mean, my hobby that I don't have much time to explore, but is art and art history. I love paintings, sort of going to museums and
So
galleries. I would love to be an art historian.
nice.
But you know, my mom and my dad were sort of saying that there's only a couple of careers you can do, and that's doctor, lawyer, engineer, and that's the end of it. So
It's a bit of that.
they were just happy that I'm going to be a doctor, and I was happy to do that. So I never really seriously considered that. But it's definitely something, a hobby. That's something maybe I can be more engaged in the future.
Do you think that maybe when you leave medicine, that's something that you were going to
Yeah, I think it's going to be
look
more of a
into?
hobby than an
Yeah,
actual sort of
work.
full-time job or work. I think the other thing that I'm thinking now, and I have been thinking, is whether is there another way that I can influence more people at once, and maybe that's what you're doing with your podcast, because you're sharing your knowledge, hopefully with a larger audience.
Yeah.
So I'm hoping to do that with medicine one way or the other, whether this is through engaging in clinical trials, because actually if we do come up with a new medication, we can influence so many people, or actually being involved in some healthcare, a technology company or any other sort of larger impact
Yeah, I
project.
no, I agree with you, and that's something that often we healthcare professionals, we kind of want to put it out there and influence people, not like other influencers do,
Yeah.
like wear this, wear that, but more like, let me share my knowledge. And it's one of the reasons why I started a podcast as well. I just felt like I know this interesting people, including yourself. I know a lot of interesting people. I have some knowledge. I'm learning more, and I just want to share it.
Exactly.
And that's my passion.
Because I think, I mean, I find an enormous satisfaction, and I get satisfaction from treating patient by patient and helping, some great stories, and when they're getting better, when you feel like you made an impact, it's a great feeling.
It's a great feeling, yeah.
But it also feels like it's one after like it's one at a time. Whereas if I could have a larger impact at once by doing
Okay.
something,
That's a
it'll be
good point. Like
difference.
coming up with a new drug or something that can immediately impact
So
on a
much
lot
more.
of patients.
Exactly.
It's a very good point, but I'm sure you're gonna get there very soon. And I wanted to ask you, okay, moving to some hot topics in healthcare. So, what would you say is the one medical breakthrough or trend which you're most excited about right now?
I mean, this is probably something that's been talked about a lot, but I am quite excited about the GLP-1s, so in the injectables, as well as now I think Eli Lilly is developing a tablet that is as effective as Manjaro. Um, so I think that's very exciting because the research that I've read is very positive, and
Yeah.
it not only affects the diabetes, which is obviously the first primary indication, but there is also the effect on the protective for the kidneys and lowering the cardiovascular risks.
Yeah.
That goes hand in hand with lowering the weight, so weight reduction, which obviously can help with lowering overall risks. And I've seen also real life stories that are very positive too. I know it's a medication you probably have to stay on, but then so are a lot of other
Yeah.
medications.
Yeah, most
Most
medication, when you think
medications.
about it, like
Yeah,
for your blood pressure, or you don't just take it for a certain amount of time, but you actually
exactly.
have to stay on it. But do you think that maybe people are overusing them?
Yes, I think, I mean, unfortunately, quite a lot of them can be prescribed online without a proper kind of consultation. They can be obtained also abroad without any consultation whatsoever. And
Yeah,
lots of people are using it for losing weight when they don't need to, and
that's
it
what
can be
concerns me.
dangerous.
Yeah.
And I think there's new evidence coming out about, actually, it was today a discussion with one of my colleagues about menopause, HRT, and GLP-1s.
Okay.
So there's some evidence that actually the being on Manjaro or GLP-1s delay the gastric emptying, which we know, so that delays the digestion.
Yeah.
But that means that some medications can be less absorbed or they can be less effective.
Yeah.
And one of the parts of HRT is micronized progesterone, which is the bioidentical progesterone. And actually, it we need to now switch it if someone is on HRT.
Oh, wow.
That's the evidence that actually it's not enough because of the absorption is lower.
So there's probably like interaction between them.
Interactions, yeah. So I think
Yeah.
there's new interactions that we're learning about. So kind of we need to watch the space. And when someone is on GLP-1, we sort of need to think about what else they are on, how else can it be affecting them, and so maybe consulting a medical professional about that.
That's I think, not obviously we're in healthcare, so we're aware,
Mm.
but a lot of people are not aware of interactions, and that basically that you take one medication and that medication can affect how the other medication is absorbed, causing too much of that medication or too little of that medication,
Yeah,
which is both dangerous because too much can mean toxicity and side effects, too little may mean lower efficacy and it not working. So it's a
exactly.
very actually good point. Thank you for telling me about it. I had no idea, and I think I should know about that as a
It's
pharmacist.
literally like it's very hot. Like
Fresh.
I think it came out like 2 days or 3 days ago. So it's on the British Menopause Society.
Okay,
So yeah.
amazing. Um, I was going to talk about, since obviously you're a doctor, I'm a pharmacist, we work closely in a healthcare. Um, what's your relationship with pharmacists? Do you find us a bit annoying? Because in the hospitals, usually there's a bleeping system. So I would cover a ward and there's going to be a doctor looking after a patient, a nurse, a pharmacist, and I would bleep the doctor. Can you write the discharge summary when patient's going home, or can you change this medication, or this dose is wrong? And sometimes I feel like some doctors absolutely love me because they're like, oh, pharmacist, you saved my life. They want my opinion. And some other doctors can find me a bit annoying at the times if I'm like, you prescribed the wrong thing. Why didn't you consult me? And they're like, I know better than you because I know the patient better. And sometimes, there's some arguments.
Yeah.
What's your reaction? Like, what's your relationship with pharmacists?
I mean, my relationship with bleep is very bad.
No
I mean,
one
it
likes
gives you
the bleep.
anxieties
It
because it
gets
bleeps
upset.
all the time. And sometimes it bleeps about things that you don't need to be bleeped about. Having said so, there's a culture of openness, and whenever you want to ask a question, you should.
Absolutely.
So I personally actually really got along with pharmacists in a hospital and now in my current medical practice. So I think they save you. So if you made an error, or if something is just not quite right, or just doing those calculations that can be quite complicated, I think they're absolutely essential, and I'm thankful for you guys. And yes, if there's like 10 things that you have to change, the only thing I was getting annoyed is the system, the sort of the computer system that was
Yeah.
very difficult for us to alter it. You have to kind of unblock it and block it, and that was the annoying part. The
Yeah.
actual fact that the pharmacist is checking, or having questions, I think that's brilliant, because it's a lot of safety, and
Yeah.
doing those safety nets like a Swiss cheese, where
You're
errors you're
checking
checking, and so
everyone
you
is at
avoid
checking
errors.
at each stage so that
Exactly.
the error doesn't get carried through.
Exactly, and doesn't affect the patient.
But I like what you mentioned about systems, that different hospitals obviously and places use different systems, and some can be very tricky to navigate, which is actually bringing me to the next question, that there's been a lot of debate about. So we touched base on Ozempic
Yeah.
and your opinion of Ozempic. I mean, anything further you would say about Ozempic and its overuse right now?
Um, I think I think probably we in NHS, because
Yeah.
that's where I work, we have to sort of focus on how we can deliver it safely and on a larger scale, because we do a lot of other programs that are weight loss programs or diabetes prevention programs. They're just not effective. And I think
Yeah.
doing some kind of hand in hand into management of the diet with exercise and obviously pushing the lifestyle side by side with actually being able to procure those Ozempic
Yeah.
and procure those GLP-1s. I think that's where we should move on to, whereas I think now is a bit disjointed.
Yeah.
And I think in private world, again, I mean, we have to sort of think about how we can stop this over prescribing. But
Yeah, absolutely.
yeah, I don't know if we have any ideas of what should be done.
I can't really think of anything. I just know that recently I've heard a story of a patient coming in because they've taken too much of Ozempic and they've kind of self-diagnosed, taken it from online, and they, you know, how you have to start with a lower dose and then
Mm-hmm.
titrate, I
Yeah.
think weekly or not sure exactly how frequently. And she started with the highest dose, injected herself with the highest dose, and she was really unwell. And she was actually admitted to hospital. So I just think that everyone needs to be cautious. And like you said, there has to be like a thorough discussion with a healthcare
Yeah.
professional and obtain it legally. Also, I read something in was it NICE guidelines? That's like National Institute of like healthcare
Clinical,
excellence,
yeah,
clinical excellence,
excellence.
which is basically that sets out guidelines, what doctors, pharmacists should prescribe, etc. And it said that to be very cautious with like where the Ozempic is obtained from, because there have been some incidents where the formulations have actually containing insulin in it. So less of a drug and more like insulin. So they're kind of like, they're not fake, but they are not maybe what's actually written that it is inside. So I think it's just, yeah, being cautious. And I think there's definitely an over prescribing of it
Yeah.
as well.
And we'll see probably more of those kind of people coming with some side effects of it.
Yeah.
Um,
And like you said, interactions
and
as well, which, but we
interactions.
are only learning of interactions now
Yeah.
because we haven't
Used it so
used
much.
it so much.
And it doesn't come up so often in clinical trials, because
No.
people that are accepted for clinical trials, I mean, you know more than I do, are generally wouldn't be on that many medications, and maybe they do check the interactions before admitting someone, which I'm
Absolutely.
sure they
I
do.
would say people doing clinical trials are usually healthy individuals
Yeah,
who are less likely to be on many medications. So
exactly.
this about interactions, that's usually discovered once the drug is actually
Out
out
there.
in
And it's been out, but not that long. I mean, comparing to some other ones.
other drugs.
Yeah.
Absolutely. So we mentioned about diagnosis and all of that. What do you think about telehealth
Mm.
and like technology? So telehealth is basically reviewing, diagnosing, and potentially treating the patient online via, I don't know, name it, any system, let's say Zoom, whatever, I don't know.
It's patches
Yeah,
and yeah, all different ones, but yeah,
different ones.
different.
Okay,
Yeah.
and what's your thoughts on AI, telehealth? What's your perspective on this issue? And do you think that an online, let's say, review, like you
Mm-hmm.
review patients all the time, can the in-person contact be replaced by that, or is one better than another, or is, you know, is online one is
Mm.
sufficient to make a, you know, accurate diagnosis?
I think it's going to be, it's like the future of AI, how I see it, and the future of digitalization is that we have to merge in a sort of harmony somewhat. And it's very difficult to find the right balance. I have quite a lot of patients who are young and they are quite good at self-diagnosing. So actually communicating with them by a telephone when they're busy doing their, whatever it is, they are either working or working out or whatever, they just have a call with a doctor and they know quite precisely what's going on,
Yeah.
and then I can support it. We communicate. And then I trust him, and I can make that diagnosis if it's usually quite a simple one.
Okay.
And we can put things in place, like for example, blood test, or so then I can recommend a urine test or whatever, and then they do that, and then we might meet in person if there's something to examine.
Okay.
So it's almost like a merged process. And then, but there's also other side of the story is that there are patients who this is not suitable for, so elderly, that cannot use any technology, and they still walk into our clinic and just request an appointment sort of by speaking to someone. They still want that because
Yeah.
they cannot do it otherwise. And for them, it's so important to actually have someone
in
in
person.
person, and they value that so much more than someone than even if the AI was smarter, they're not gonna take that advice because they just don't trust it, and that's
Yeah.
what really is impactful for some people.
Yeah.
Yeah.
And do you think that ever we're gonna get to the point that so you said when if there's like a need for examination,
Mm.
like whatever, examining the skin because
Mm.
of a rash or rectal examination
Mm.
or whatever.
Yeah.
Do you think that that can ever be replaced by like some AI technology?
I mean, skin maybe because there is Chelsea Westminster is actually doing AI on skin cancer, so AI recognition of skin
Yeah.
cancer. So I think maybe the skin, yes, more so, but
So
there
it's
is still
visible.
visible, but there's still
Yeah.
a value of actually feeling a lesion or feeling a rash.
Yeah.
But I think in terms of other examinations, I don't think so. I think it's more likely that the examining part will be still doctors, and then we're going to sort of put the examination findings into
AI
AI,
machine,
a machine,
robot.
and then rather than anything else, and this then coming up with something of potential diagnosis, and then we review. And I think in America, now that there's some kind of laws about AI, and I think it's going towards it's a support tool, but the decision eventually is
Needs to come
a decision
from
from a
a person,
doctor,
a
for
doctor,
exam. Yeah.
which basically means you will never lose value. You're never going to be replaced by a robot. But no, jokes aside, I wanted to talk about being a female in
Mm.
healthcare and in medicine. What is your, like, as a woman in medicine, have you faced any unique challenges or stereotypes, gender biases? I feel like, or like balancing expectations. I feel like this used to be a problem back in the days,
Mm.
and now I feel like medicine is becoming more of a female world. What's your thoughts on like
Yeah.
being a female doctor? And obviously, do you experience any of these challenges, or you feel like now they're gone because there's so many females being doctors,
Mm.
being uh pharmacists, etc.?
No, I think that it's yeah, it's mostly now female dominated
It
industry.
is.
Maybe not surgeons. There's still a little bit of a male domination there, a bit of a cliche of that's a kind of male thing, and it still is actually. But I think everything, every kind of other specialty, there's a lot of women working, and therefore it's never been a challenge in any way. I actually quite like working with have the variety of working with men versus women sometimes, and I think it's good in a hospital or even in GP practices that you're seeing different doctors here and there occasionally. Maybe it's nice to have your own main GP,
Yeah.
but when you do also see others occasionally, because everyone has a fresh pair of eyes
Yeah.
and everyone has a different approach. So men are much more decisive. They are much more better sort of quick on their feet,
Mm-hmm.
whereas women are much more sort of they consider all angles
Yeah.
and they're much more careful. And that's maybe okay. It's oversimplifying it, but that's what I generally noticed working with both.
Yeah, I agree with you with that, that men are more decisive,
Mm,
but women might be more like empathetic and like understanding and considering like all aspects, looking patient as a whole picture
exactly. And
rather.
both of those things are useful, and that's why you need maybe it's nice to actually have different people involved in a care of a patient.
Yeah,
Yeah.
I agree. And what advice would you give to young women considering career in medicine? Not just women, actually, anyone
Anyone.
considering career in medicine.
Well, I would say that it's definitely a devotion. It's not for money. It's not even for the sort of the splendor of being a doctor. I think it's definitely a devotion, and I think you need to be happy or have happiness from treating people and helping people, because without that, then there's it's long hours, is commitment with losing on your Christmas, and there is long way until you're fully qualified. There's low pay in many countries, so unless you have a lot of happy feelings from making people feel better, it's not gonna be for
It's
you.
not for you.
That's for you.
I
Yeah.
agree 100%. And you mentioned working Christmas, long hours.
Mm.
So that was going to be my next discussion. Um, Basically, how do you manage stress, stressful situations, also some difficult conversations with the patients? And also, how do you stay like healthy? How
Mm.
do you take care of yourself, like well being, considering you have night shifts, maybe not at the moment, I don't know, but like in general, working as a doctor, especially junior doctor, which you know you're not now, but back in the days, like being a junior doctor, you're expected to do night shifts, you do 24-hour shifts, really long hours, not getting enough sleep, drinking so much coffee. How do you stay healthy? How do you manage the stress and prevent the burnout?
Yeah, so I think it's important, and not only in medicine and healthcare work, but in any work, you have to make sure that you have some routines or some things that are just gonna be your time out.
Yeah.
Where whether that's a walk for a coffee or a little, come outside for a little fresh air, or so it's important to have those mini routines throughout the day that sort of keeps you detached for just a second,
Yeah.
so that you're not overly sort of like on a overarching stress all the time. So
Yeah.
those are very important. And I think also keeping healthy with the usual things, which is, eating well, not drinking, which impacts your sleep, impacts
So
your eating
much.
habits, impacts your liver health. And getting enough sleep. I mean, this is almost like a new disease, and insomnia is so common. It's so
So
common.
common.
And there's so many different strategies for dealing with it, which is an almost a podcast on its own.
Yeah.
But that's why it's so very important to sleep well.
I,
So whatever works for you to make that
yeah.
happen.
I was gonna ask you, what's one self-care habit you swear by? It's something that keeps you grounded outside a hospital or clinic, but I think we can both agree that sleep,
That's
having
sleep,
good sleep,
having good enough sleep, which was
and
tricky when I have night
yeah,
shifts because you then come
absolutely.
back home.
How would it be like after working all night? Do you come home and you sleep, or?
Yeah, I mean, I always try to go to sleep as soon as possible. So I would have like a small breakfast, and I would keep the meals the same. So different strategies, but for what worked for me is having this morning still being a breakfast meal or whatever, like a porridge, and then going to sleep basically, and blackout curtains, mask, earplugs, so whatever else, just to have as much as of a normal
Like,
environment.
yeah, for sleep.
Yeah, for sleeping, and then really trying to get this 6 minimum of hours of sleep before a night shift, then having dinner. And then trying not to eat during the night shift. Like it's really hard.
Really? Is it because it will then make you
Make
obviously sleepy?
also you're also then makes you sleepy, but also kind of makes your metabolism switch. Why am I eating at night? It's enough that I'm not sleeping at night. Why am I also now eating at night? And it's only for like 3 days, and then you're back on days.
Yeah, which I find the most difficult
Most
thing.
difficult, yeah.
But I remember because we also as a pharmacist
Mm.
have residency when we are junior pharmacists. After we get like our training and we become officially registered, we usually, most hospitals, depending in which hospital, especially the large general hospitals,
Mm.
they would have residency. So a pharmacist for 7 days works like midnight till 9 a.m. And then like the next day they're back to normal
Yeah.
working hours. And for me personally, I did it for a week and I said, I can't do this because
Mm.
I felt like my sleep is affected, my mental health was affected, and I just felt like I can't provide the best care to my patients if I'm like half asleep in the middle of the night. And I then shifted to like another hospital which had on-call service where
Mm.
I would still I would be at home, but they would just call me for anything,
Okay.
and they would still wake me up in the middle of the night, like at 3 o'clock, or 3 a.m., 4 a.m., 5 a.m. Sometimes for something that's not really urgent, but at least you kind of have some sleep. They
Kind
wake
of
you
have some
up.
routine around. Yeah.
Yeah, it was a little bit, it's still not great. It still affects my sleep. You still have to go to work next day, but it's a little bit better. I
Mm.
personally, residency didn't work for me, but I'm glad I experienced it because it does teach you, it teaches you some lessons, and working in the middle of the night by yourself, often you really become a better, maybe a better pharmacist,
I
better
think, I
doctor.
mean, I think so. It definitely um, teaches you resilience.
Yeah.
And also, I mean, I think what I'm always laughing is that when my girlfriends are having kids and they're like, oh, the sleeping is on and off, and I'm not sleeping all the time because, the kid is waking up at night. I'm like, it's no problem because I've learned this, I
Yeah,
can fall asleep quickly, I wake up quickly, I'm fully alert, and I go back to sleep because it's almost like
absolutely.
I had that training.
I think the bleep is like a baby
It was like,
sometimes.
exactly. It's
You
like
get bleeps
you
today. We need you,
need you, and you're like fully alert, and you're like running. Sometimes you'll be on an obstetrics, so we'll be delivering babies at night. Literally, everything just calm down. We can maybe relax for 20 minutes, and then it's like panic button or alert, and then everyone is like running with
Someone's giving birth.
giving birth, or
Oh,
something will
wow.
happen, so we need to assist. And then you're like, ugh, so from 0 to almost 100, right, in
Yeah.
seconds.
Yeah.
So it taught you a
Which
lot.
is which is fun. Like you said, it's interesting, but it's also, it can affect like your mental health, this lack of sleep, also stress, having difficult conversations with
Mm.
patients. Um, um, do you feel like have you had any very difficult conversation, like let's say with a patient, that really like impacted you, or
Mm.
have you ever, do you have like any interesting story from like a patient, something that really like you kind of remember, it stays with you?
Um, I think I think whenever something bad happens to my patients, it always stays with me for a while. I think you always, as a doctor, you'll always remember the first sort of someone dying,
Yeah.
and that's something will stay, whether for life, I don't know, but it definitely stays with me still. So, being in a hospital and someone arriving literally through the emergency unit, me seeing them, and within hours them passing away, like there's something that definitely will stay with me. um and I think it's not really, it's not stopping me from sleeping or being happy, but it's almost like makes you appreciate life, and also makes you want to work harder to make sure that doesn't happen to anyone as much as you can prevent it. um, so those stories do. But there's also the happy stories that stay with you, right? The
Absolutely.
times that I was doing preventative healthcare, which I'm very passionate about, and I'm very supportive that this should be the next big thing, really moving towards that.
Yeah.
And I was just doing that with a patient who came from somewhere else, and I wanted to just sort of provide like holistic care. So I was like, let's just look at everything, make sure you're optimized.
Yeah.
And I detected a cancer, and that was sort of
Oh wow.
before metastases, and we managed to, have a surgery and everything, and yeah, and now so it's like it's a happy story in the end, even though we did detect something
It must
significant.
feel very rewarding because
Mm,
obviously someone getting diagnosed with cancer at a very late stage,
yeah,
when it's metastasis, the prognosis is quite poor
exactly,
depending on the cancer and obviously patient factors, but it usually is poor. Whereas if it happens before and you can, give chemotherapy or operate on a patient, then the patients can really go into remission and be cancer
exactly,
free and live a happy life, happy long life. So it must feel very rewarding,
yeah,
you as a doctor being the one who diagnosed it and save
exactly.
someone's life.
And just by doing the preventative things, there was
Yeah.
no symptoms, there's nothing to really go about. It was just me doing, okay, let's just look at everything that we can in primary care.
Yeah.
And yeah, so that's definitely something that it's a good story.
Absolutely. No, it's
Yeah.
an amazing story. And you made a right point. Preventative
Yeah,
rather than just treating when it already happens. That's
exactly.
something that needs to be appreciated more.
Mm,
And yeah, talking about mental health, I was actually looking at this and like a burnout that young healthcare professionals have. And I came across something that I never actually heard before, and it's called the imposter syndrome. And I didn't even know what this is, but apparently this is quite common with like healthcare professionals and successful people. And it's basically that you constantly think or feel like you're a fraud,
mm,
and that you're worried that someone's going to find out that you're not good enough, that you're actually faking this, that everyone else is better than you, but you're actually successful, qualified, smart, intellectual person, but you constantly think that you're fraud and you have fear that people will find out. And that happens usually to people who are, often very ambitious, people who are often comparing themselves to others under some kind of pressure, whether it's personal or cultural pressure, and just people thinking who constantly think, oh, I could have done this better, I could have done this better. And also people who have a bit of low self-esteem. And I haven't even known, I never heard of this imposter syndrome. I don't know if you have, but I feel like I definitely, maybe not at the moment, but I've definitely had situations when I had this.
mm,
And it's really interesting. And I look into how to prevent this and, talking about it, looking at these mistakes, and we all make mistakes in healthcare, we all make mistakes, looking at these mistakes as a, like learning
mm,
opportunities rather than mistakes, and not comparing yourself to other people, and understanding that in order to grow, you need to be in some uncomfortable situations. But it can, the imposter syndrome, people can have symptoms and it can get to the point that they need therapy and maybe even medication, but it's a serious thing. But no, back to our self-care, and we talked about actually stress and everything. Thank you for that. And um, do you feel that what I was going to ask, healthcare system does enough to support the mental health of doctors and other providers? Do you think that anything needs to change within healthcare system to support the doctors better? I personally think that this whole like um around holidays and
Yeah.
everything. It's difficult to tell someone you're working on a holiday. I think more like letting people choose maybe when if they want to
Yeah,
work on a holiday.
yes, I think maybe because we are obviously a multicultural society. So I think we should also start recognizing that, Eid is also a holiday, right?
Yeah,
So or celebration and or some other belief systems, and they might have different celebrations. So actually recognizing that, what, let's everyone should to start with maybe submit which days are important for them, and
absolutely.
sort of have a space or a forum where they can agree, because some of my colleagues who don't celebrate Christmas don't mind it, but for me it's
Absolutely.
such a big thing.
Yeah.
And because of the rota and the sort of how our scheduling works is not always possible, but then it's flexibility would be great. But I also think it's quite unusual that doctors, we deal with sad stories, good stories. There's a lot of emotions that other people sort of put on us, because it's difficult to see everyone every day, 15, 30 patients, each in a bad situation or each with a problem.
Yeah.
And I would like that there was a lot more mental health support for doctors, where we have a place where we can talk about things or our life, and actually this being fully funded, which it isn't. Like
Yeah.
I've tried from NHS to try to have talking therapy, which is
Yeah.
cognitive behavioral therapy, which is great for some patients and for depression or for mild anxiety. This really works, and I'll recommend it for patients. But I think for me, it wasn't really the kind of therapy I needed.
Yeah.
Or I wanted. I don't need it, but I wanted it, because I think we should exercise our minds like we do with our body, and
Absolutely.
doctors especially should exercise their sort of feelings and minds and how they think about things. So an outlet for that, like an interpersonal therapy or some sort, would be great.
That's one thing we missed.
Yeah.
I agree with you. And we talked about technology and AI shaping the medicine, telemedicine. What do you think is one skill or mindset that doctors need to develop to stay ahead in the future healthcare?
So I think we need to be very much developing quick, like sort of IT skills, because the IT is the one that is still struggling in healthcare comparing to other industries, at least in NHS or the national health system in other
Absolutely.
countries. And I think the more doctors interested in that can really advance it in line with how the society is going, without losing that patient contact. So we have to learn how to merge those two. And that's why I think being quick and understanding how the system can work and what's good and what's bad, and people actually, adopting new technologies, we need that. And I think there's quite a lot of people who are very reluctant to change.
Yeah.
They just want to, nothing change. They're just they're afraid of it, and they don't
Yeah.
want to. And I think that's what we need to accept, that this is the future, that the future will bring new technologies, it will bring new system, and we just have to be okay with changing and adapting.
Absolutely. And you mentioned to me before, navigating multiple systems more efficiently is what a goal should be for every healthcare professional. And if you could have a magic wand and fix one thing about healthcare system, what would it be?
So I think that moving from treating and reacting to really preventing, that's definitely my message. And I think to everyone, that's what should, not only doctors and healthcare system, but
Everyone
also
else,
everyone
really.
else, really.
Absolutely. Oh my God, we discussed so many things. I'm very, very happy and sorry for bombarding you. I just lastly, literally before you coming here, I was scrolling through some news and I came across a couple of very like trendy big TikTok trends at the moment, which revolve kind of medicine. One of them is very popular right now. I don't know if you heard it and what's your mind on it, and it's called Speak Your Mind Ice Bucket Challenge Revival. So remember the old Ice Bucket Challenge, which was for ALS, supporting research finding a cure for ALS. This one was actually revived by Wade Jefferson, a student at University of South Carolina who was trying to come up with an event for the mental health awareness club he founded on campus. And now this is basically helping raise a wellness awareness for mental health. It's called Speak Your Mind Ice Bucket Challenge, and it raised over $190,000 dollars in the like community. What's your thought on this challenge? And like,
I mean, great. I think we should do all sorts of raising awareness. Now that also there's some funding being removed in the US for research, as we know. So I think whatever else we can do as a community to support awareness or clinical trials, I think it's amazing. And I think as like a challenge is great, but I also and we should continue it. But I think the message should be clearer, maybe a little bit, because there's also another Ice Bucket Challenge about something else, I believe. And the thing is, people are actually doing the Ice Bucket and they're nominating people, but they're not donating,
Yeah.
which I found with
They're
ALS as
missing the
well.
point.
They're missing the point. It's
Yeah.
like it's not about pouring, ice water on your head and doing it on Instagram. It's about actually supporting and knowing a little bit more about what this is about and what's behind it. So we learn and we actually raise the awareness, not just for
Yeah.
water.
Yeah. Made a viral video. Another trend, which you might haven't seen or heard, skinny talk, body images concerns. Basically, there's a segment on TikTok known as Skinny Talk, promoting extreme thinness and unhealthy dieting practices. And then experts are warning, this is bad for mental and physical health, and there's risk associated with this trend, especially within young like teens. I personally have seen couple, and it's like super, super skinny person sharing, this is what I eat in a day. This is what I do. And as much as I love the idea of like, you have a diet which works for you and you're like skinny, whatever, and that, you want to share it with other people. And I think that some people do it with the best intention. I also don't like the whole, it's not body shaming, but it's like, some of the videos there are really unrealistic body images. And, for someone who maybe genetically is just bigger, that might seem impossible to reach that weight. And it's just like showing what you eat in a day, but actually, eating nothing and making other people look bad. I'm not a fan of that. I don't know
I'm
what's
not a
your
fan.
thought.
I mean, I think there's a lot out there on social media, on TikTok, on Instagram, that's just not true and or not good for you. And I have patients coming to see me about all sorts of ideas that are just I know where they come from and they're just not correct and they're just unhealthy and some of them are quite ridiculous as well. Without judging anyone, you're right to but they're actually the right thing they're doing is that they're coming to me
Yeah,
or a doctor,
absolutely.
another healthcare professional, pharmacist asking about it.
Absolutely.
I also think there should be a little bit of I mean, now we actually read more of Instagram or TikTok than we read of newspapers and proper books. So maybe those companies should actually there should be some kind of checks for this,
Yeah.
because it can be dangerous.
Yeah.
And I think yes, I know there is some political checks, maybe or censorship, but there isn't enough to remove the content that can be harmful for health,
Absolutely,
harmful for one's
especially
health.
to young people who are mostly
Exactly.
on those platforms.
Yeah.
And finally, this one is quite funny. Bulcan breakfast craze. It's basically promoted in 2025 like a healthiest breakfast, a Bulcan breakfast. I'm obviously Bulcan, and I find it really funny. And it's basically on a big plate for a breakfast. You have raw food like vegetables, bread, meat, and cheese. It looks super random. It looks super old fashioned. It's kind of thing my grandfather would eat, but it doesn't not look fancy or anything. It's just super funny. And yeah, I find it just emphasizes the protein and fiber in how that's quite a good for breakfast. But
And I think, if there's protein on a plate, that's already a good start. So
yeah.
however random it looks, we polish a cucumber with like everything.
Oh yes, I
Um,
love Polish food. It's so different.
it is different, and I think it's made for like cold countries, and it's so great and sort of homey in autumn or winter. It's amazing. It's also quite a lot of protein based, which is actually quite healthy. So yeah, I mean, whatever works, as long as you're getting the right nutrients, right, in the right proportions.
Absolutely. So what
Yeah.
would you say is one typical Polish breakfast or lunch or dish?
I mean, we like eggs, which I think is
Mm.
are quite healthy.
Seen them put them
So
like added to the soup and stuff.
yeah, we add them in the soup. We eat them on a sandwich. We make it obviously the scrambled as all the other sorts of eggs. We put them on a like next to a meat. We do everything with
Everything with eggs.
everything, and then, they are a great source of protein
They are, absolutely.
and healthy fat. So I'm not sure that's the most famous, but I think definitely we eat a lot of it.
Yeah.
Yeah.
Oh my God, this brings us to an end. Thank you so much. I really love this conversation, and I feel like I've actually learned a lot from talking to you.
Thank you.
You
Likewise.
are a brilliant doctor, an amazing person, and I hope that you come join me again, and we
Yeah, I
will
would
be
love to.
talking. We have so many
So many
topics to
topics.
explore. So please continue. Helping people stay alive. Thank you for all your hard work.
Oh, thank you very
Um,
much. Thank you for having me. It's great to be here.
Oh, I'm grateful. And yeah, hope you join us again. Thank you guys for
Thank you.
watching. And yeah, if you like, subscribe, share, comment, and yeah, I'd love to see your feedback. And please join me next time as well. See you and
See
take
you.
care.
Bye.
Bye.